Hi everyone, Dr. Kaliko here, and today I want to talk about equity or fairness in the distribution of vaccines. So it just so happens that today is March 26th, which is the Stop Asian Hate National Day of Action. And I just came back from vaccinating about 50 people working at local congregate living facilities, and almost all of them happen to be Filipino. And some of you may know, but most of you probably don't know, that there are huge health disparities in our Filipino populations when it comes to COVID-19. So we have a disproportionate or really large number of deaths in our community relative to our numbers in the population. And a lot of this has to do with our exposure to COVID-19 in the community, through our workplaces and other means. So what do we mean when we say fair and equitable? Really, it just means that everyone who needs the vaccine gets access to it. And that means prioritizing those who are at highest risk from death and from hospitalization from the disease. And, not only on paper, but actually in practice when it comes to how it's happening in real life. So we're talking about people with certain medical conditions, people with disabilities, people of color, including our Black, Latino, Native, and Asian communities as well. And so the question is it possible to make vaccine rollout equitable without sacrificing efficiency? So can we do this as quick as possible and get as many shots in arms as we can, and also pay attention to making sure that it's fair and that those that are at highest risk are getting prioritized? So I would argue that it doesn't have to be an either or situation. It can be both and. And the way that you do this is not by putting up barriers or unnecessary restrictions to vaccines, but it's really in, you roll out the vaccine and get it in as many arms as possible. And you also do targeted outreach events. So this might look like going into assisted living facilities that serve our elders and people with disabilities. It might look like collaboration between vaccine providers and organizations that serve people with disabilities, people of color, maybe faith-based organizations, and holding special vaccination events in a location and during hours that are convenient to that community. So rather than relying on people coming to us as vaccine providers, we would go to them. We have organizations going into people's workplaces. For example, here in California, the California Farm Worker Foundation has been doing so much work in going to the farm workers in their places of work in the fields and providing them with vaccines right where they work. So it's not, a lot of times our clinics, our pharmacies, these locations don't necessarily have convenient operating hours to people, when people are working. And so it's very inconvenient and very difficult for people to be able to come to us sometimes. So that can be very helpful. We have some of our local federally qualified health clinics or free clinics. For example, Clinica Sierra Vista in Kern County they have a street medicine team that is going out and vaccinating our unhoused neighbors, out in the streets. So really, when it comes to making vaccine accessible to the most vulnerable of our community, we need a multi-arm approach, pun intended, right? Some of the problems that we're seeing with trying to do these targeted approaches in practice, so I've seen in LA County, clinics that are trying to go into zip codes that have the highest death rates. So for example, there are parts of LA that they're trying to vaccinate predominantly Black neighborhoods. And however, we have some white residents from other zip codes driving into these neighborhoods and taking up some appointment slots from the residents that it's intended to serve. So, there has to be some way of verifying residents or, verifying eligibility for some of these events without necessarily making it overly burdensome. So, having some reasonable flexibility built in there. So whether that's, verifying ID can be one way, but also realizing not everybody has a state issued ID for many different reasons. One example is if you happen to be have undocumented immigration status. So can you use something like their work ID or their school ID instead, just something that you can identify the person by? Or if you need to verify their place of residence, maybe it's a utility bill or something like that. So there's many different ways that we can make vaccine distribution more fair and more equitable. And it's really up to us as vaccine providers and our health departments to track that data and really make it a priority.